So very good morning to everybody. This is Muskan from the Jammu and Kashmir writer. Today via this video we're going to talk about something very important, an issue which is rising and people are still not talking about it enough. The government is not doing anything about it and it is still a hidden crisis in the beautiful and heavenly valley of Kashmir. This issue that we're going to talk about is a little sensitive, so I would request all the parents and all the adults to make sure that children are not watching it, and if watching, then they are watching it under the supervision of you people. We are delving into the pressing issue unfolding in the Valley of Kashmir, and that is rising of the female drug abuse. Now, coming to understanding the problem, why are women in Kashmir so susceptible to drug abuse? Now, if you read our newspaper, you'll get to know that there are different triggers, different reasons for it, but in this video we're going to talk about the psychological triggers which is leading to the drug abuse, the rising drug abuse in the Valley of Kashmir. Firstly, let's just understand that when we talk about the adult females in Kashmir, why are they going for drug abuse? So these triggers include domestic violence like physical abuse, sexual abuse, financial abuse, and psychological abuse, one being narcissistic abuse, which is the most common of all. So why are young girls between the age of, let's say, 15 to 20 are so susceptible to drug abuse? We can understand the condition of the adult females in the Valley of Kashmir, but what is the reason that these young females who are getting themselves educated, going out and about, enjoying the Valley of Kashmir, are lured by drugs? One of the most common reasons are lack of parental guidance, lack of awareness about drugs, and psychological trauma or psychological issues that usually happens during their age group. Now, the issues are quite understood, but what is it that is stopping our Jammu and Kashmir government to collect the proper data and do surveys to actually understand the scope and nuances of the female drug abuse which is happening in our own Kashmir Valley? What is the reason? ऐसा क्यों हो रहा है that there is no official data and nobody is actually really worried about it? Nobody is concerned about the rising cases of female drug abuse. The doctors are talking about it, the authorities are not. So the reasons are quite understood, but what is it that is stopping our government of Jammu and Kashmir to do anything about it? Why are they not actually collecting the proper data and trying to understand the scope and nuances of the female drug abuse which is happening in our own Kashmir Valley? What is the reason? What is the reason that our doctors are talking about it but our authorities are not? And if they don't want to talk about it, why are they not providing proper mental health care, rehabilitation care to the people, to the females who are actually suffering from it? And why is it still a taboo? As people of Jammu and Kashmir, I would like to believe that we have become progressive enough to talk about female issues. But when it comes to issues like drug abuse, we feel like these issues are limited to males. But then we need to understand that drug abuse is not limited to a particular gender. Anybody facing any kind of mental health challenges, any kind of issues would in some way or the other lead to issues like drug abuse. loopholes तो हर हेल्थ केयर सिस्टम में एग्जिस्ट करते हैं, हर गवर्नमेंट में एग्जिस्ट करते हैं, बट एज people of Jammu and Kashmir, from their side, I would like to urge to the government of Jammu and Kashmir to at least provide proper funding, proper health care, and a number of mental health professionals, including clinical psychologists, therapists that specializes in rehabilitation psychology, so that they come in, they enter the room and they're able to help the patients that are dealing with drug abuse, especially females who are there eagerly waiting to be understood as to why they started it and what could be the possible measures that can actually help those females to get rid of the drug abuse that is happening to them. So here I am, Muskan, finally signing off from today's video, and hopefully you're going to get more updates about the issue that we talked about today, and hopefully we're going to get updates from the government of Jammu and Kashmir as well once they see this video, or once they understand the severity of the issue that is happening in the Valley of Kashmir. Thank you.